I rise today as I rise annually to just say very simply, do not shake your baby. Recent statistics in the United States shows that 679,000 children were victims of abuse and neglect in the United States. And you know, we're talking a lot about abuse in many areas over this past few weeks. 6,482 were under the age of 1. The particular thing that I'm talking about today, though, is shaken baby syndrome, which is also part of these abuse statistics. It's stated that between 1,200 and 1,400 children annually are diagnosed with AHT or shaken baby syndrome every year. And it is simply that. It is someone who decides, for whatever reason, usually because the child is crying, to shake their baby. The reason why I stand up annually to talk about this is because 14 years ago, a child, 8 months in the custody of a babysitter, was killed. And the babysitter couldn't figure out what it was that she'd done. And actually, after the autopsy showed the trauma to the brain of the child, it got back to the fact that the babysitter shook the baby, and the baby died.
There are more cases of shaken baby syndrome and infant abuse each year than cases of sudden infant death syndrome. In fact, shaken baby syndrome kills more children than fire, electrocution, drowning, poisoning, and motor vehicle accidents combined.
When you shake a baby, 2 or 3 things happen. One is most shaking is back and forth, and when you do that, the brain then bounces in the head, and that can tear the different components inside the brain. It can cause distortion of the brain matter, which puts things in positions that they're not supposed to be in. And the culmination of that can be a severe brain injury and sometimes, unfortunately, frequently death.
The outcomes for these kids are life-altering, both for the child and for the family. Many of these kids have lifelong developmental and physical delays and deficits. In fact, many of these kids will never walk, talk, or even ingest solid foods.
I was left with complete blindness. I had seizures up until I was about 3 or 4 years old. I'm totally paralyzed from the waist down.
We don't know if she's going to survive, and if she does, what kind of care she's going to take. She suffered enough injuries that they said it would be lifelong disabilities for her.
The more seriously affected children are not going to improve. They're going to have those considerable neurological defects for as long as they're able to live.
Hello, I am Chestnut, and I am Shoemaker's Excel Club President, and this month is Shaken Baby Awareness Month, and this is our contribution to Shaken Baby. Shaken Baby Syndrome, also known as abusive head trauma, is a serious form of child abuse that causes brain injury between kids, infants to children up to age 5. Shaken Baby Syndrome is when the child is violently shaken or suffers from another form of head trauma. Shaken Baby Syndrome is completely preventable, and it may cause behavioral problems, partial to total blindness, hearing loss, seizure disorders, development delays, or even death within children. When a baby is shaken, the neck muscles within the baby are very weak, so when a baby is shaken, the baby's brain moves within the skull. When the brain moves within the skull, it slams against the skull, damaging brain tissue, nerves, and blood vessels, causing the brain to swell.
I'm Kaylee Fant, the Vice President of the Excel Club, and this month is Shaken Baby Prevention Month. Shaken Baby Syndrome, or SBS, occurs when a baby under 1 is violently shaken, causing injuries to the delicate neck and brain muscles due to the whiplash effect of head bobbing. Bleeding within the brain from ruptured blood vessels and bruised regions, and inflammation may cause functional disruption in the baby's brain due to SBS. Rocking, bouncing, gentle tosses in the air, accidental falls, and vaccination do not cause SBS. However, tossing the baby may lead to injuries resulting from a fall. Proper handling of the baby, timely diagnosis, and proper treatment may be effective in preventing permanent disabilities and reducing the risk of mortality from this abuse.
I'm Kim Suzama. I'm here with the Exchange Club. This month is Shaken Baby Awareness Month. Effects of shaken baby syndrome are irritability, restlessness, poor feeding / changing in appetite, pale or blush color in skin, vomiting, seizures, convulsions, jerking uncontrollably, respiratory issues, difficulty staying awake, paralysis, comas, bruising on the face, head, neck, chest, or abdomen, fractured ribs, broken bones, bleeding in the eyes, unable to see / eyes keep rolling on pupils, changes in muscle tone, irregular heartbeats, irregular blood pressure, hypothermia, unable to make sounds or talk, limping.
Shaken baby syndrome is easily preventable. There are many ways to prevent that. Instead of shaking your baby, you can simply rock your baby. When your baby cries, a lot of parents tend to get frustrated, which leads to them shaking the baby. Painful tosses are also a way to shake a baby syndrome can happen. Playful tosses with the baby are okay, but once you start to get a little more aggressive and out of hand with the baby, that's when it becomes a problem and it becomes a danger to your baby. Other alternatives to your baby crying and you getting frustrated, you could give the baby a warm bath. You could have the baby listen to or watch running water. You could turn on some music or even dance with your baby. You could take your baby for a ride in the car. You could put your baby down so they can crawl. Just understand that shaking and being violent to the baby is not okay.
Shaking a baby is usually caused by tension and frustration. However, shaking a baby even for just a few seconds can cause a serious and sometimes fatal form of child abuse. Babies have very weak neck muscles. Shaking your baby can cause brain injury. Remember to never, never shake your baby.